You probably think you know what happens when a woman has an orgasm. But if you're like most men, you've only seen it through movies or porn, where it's loud, instant, and perfectly timed. Real life? It's a lot more interesting and a lot more complex. I'm Dr. Emma Blake, urology and men's health expert, and today we're going to talk about something that every man should understand. What a female orgasm actually is, how to recognize it, and how to help your partner experience it more often. Here's the truth most men never hear. Women's arousal isn't mechanical. It doesn't build the same way yours does. For men, arousal usually starts in the body and moves toward the mind. For women, it's often the opposite. It begins in the brain, in trust, in anticipation, and then moves through the body. That means the connection, the tone, the pacing, the safety, all matter just as much as technique. So what's actually happening when a woman reaches orgasm? It's not a mystery. It's a physiological event, rhythmic muscle contractions in the pelvic floor, a spike in heart rate and breathing, and a neurological flood of dopamine, oxytocin, and endorphins. It's the body's release of built-up tension. Some women experience it as waves, others as one intense pulse. Some stay quiet, others don't. There's no single formula, and that's exactly why communication matters so much. Let's talk about types. Women can experience orgasm in several different ways, through clitoral stimulation, internal vaginal pressure, deep pelvic or blended stimulation, even from nipple or full-body sensory activation. None is better or more real than another. They're simply different paths to the same release. The most common is the clitoral orgasm. The clitoris has more nerve endings than any other part of the human body, so direct or indirect stimulation, by touch, tongue, or friction, often creates the strongest, most predictable response. The second is the vaginal or G-spot orgasm. The G-spot sits a few centimeters inside the upper vaginal wall. It's less about light touch and more about firm, consistent pressure. For some women, that internal stimulation creates a deeper, throbbing climax rather than the sharper one that comes from the clitoris. Then there are what we call blended orgasms, where internal and external stimulation happen together. These tend to be longer, more full body, and often leave the woman completely relaxed afterward. And yes, there are others, like anal stimulation, nipple-induced orgasm, and in some cases, squirting. But here's the important point. Every woman's body is unique. The goal isn't to chase a list. It's to listen to her body, notice how she responds, and adjust with patience. Now, the part most men miss, the secret to giving a woman more consistent orgasms, isn't about trying harder. It's about not trying so hard. When a man becomes fixated on making her come, he tenses up, overthinks, and turns sex into a performance. Women feel that pressure immediately. It pulls them out of their body and into their head. And once that happens, arousal fades. So take orgasm off the pedestal. Focus on connection, rhythm, breathing, and exploration. The more present you are, the safer she feels to let go. And when she feels safe and relaxed, her body takes care of the rest. Foreplay is also not optional. It's the bridge to everything else. For most women, it's what allows arousal to build enough for orgasm to even be possible. That means touch, communication, and curiosity, not just rushing toward penetration. And if you want to know the real marker of a confident lover, it's not how quickly he gets her off. It's how patient he is, how aware he is, and how tuned in he becomes to what her body is actually saying. So here's my challenge for you. Slow down. Be curious. Don't chase the finish line. When you stop performing and start connecting, that's when sex becomes unforgettable, for both of you. I'm Dr. Emma Blake, and if you found this helpful, check out the pinned comment below for the 4 natural supplements I recommend for supporting erections, testosterone, and prostate health. They pair perfectly with a healthy, confident approach to intimacy. Take care of yourself, take care of your partner, and remember, real confidence in bed starts with understanding, not performance.